Hello friends, let us now learn some important points about the health planning committees in India. The health planning committees of India are of different types. First, we have Boer Committee. Boer Committee was put forward in 1946. It is also called as Health Survey and Development Committee. This Boers Committee has two measures. One, it has short term measure, and second, it has long term measure. Short term measure includes 1 PHC for 40,000 population, and it has 30 beds and 3 sub-centers and 2 medical officers. Long term measures include it has 1 PHC which is 75 bedded per, and we have 1 PHC per 10,000 to 20,000 population. In the secondary, that is PHC, in the secondary health unit should be 650 bedded, whereas the tertiary or regional unit should be 2,500 bedded. Then it has given a term called social physicians, who have taken 3 months training in SPM in medical education. Then we have school health program, and we also have comprehensive health care concept. According to comprehensive health care concept, it is of 3 types. One, promotive, that is primordial level of prevention. We have preventive, which is primary level of prevention, and curative, which comes under secondary level of prevention. Then the second committee is Balwant Rai Mehta Committee, 1957. In Balwant Rai Mehta Committee shows Panchayat Raj institutions. Here this is rural health infrastructure, institutional rural health infrastructure. So it has 3 tiers. One Panchayat is called as village, Panchayat Samiti is called the block, Jilla Parishad is called as district. Then these are the 3 tiers, that is Balwant Rai Mehta Committee. Then we have Mudaliar or Health Survey and Planning Committee, 1962. This states that there is 1 PHC per 40,000 population. This also constitutes All India Health Service Scheme. This Mudaliar Committee will strengthen the district hospitals with specialist services. This Mudaliar Committee also shows regional organization in the states. Then the 4th committee is Cheddar Committee in 1963. This Cheddar Committee is mainly responsible for maintenance phase of National Malaria Eradication Program. It is mainly responsible for maintenance phase of National Malaria Eradication Program. Here 1 basic health worker per 10,000 population. There is malaria vigilance. This will do malaria vigilance, collect vital statistics, and also do family planning. Then we have family planning health assistants to supervise 3 to 4 basic health workers. This is Cheddar Committee. Then we have the next committee, which is Mukherjee Committee. Mukherjee Committee in 1965-1966. This Mukherjee Committee will delink the malaria activities from family planning. This committee will separate the staff for family planning services. It will separate the staff for family planning services. Mukherjee Committee is a basic health service at block level. Then the next committee includes Jangalwala Committee, which is given in 1967, or Committee on Integration of Health Services. Jangalwala Committee proposed that there should be equal pay for equal work. Equal work should have equal pay, and if someone does specialized work, then there should be specialized pay for specialized work. And he put a ban on private practice by government doctors. That is Jangalwala Committee. Then we have the next committee, which is Kartar Singh Committee. Kartar Singh Committee has given on in 1973. This is a committee on multi-purpose workers under the health and family planning. It is a committee on multi-purpose workers under health and family planning. Here ANMs are replaced by female health workers. ANMs are replaced by female health workers, and basic health workers, vaccinators, malaria surveillance workers, and health education assistants, family planning health assistants, all these are replaced by male health workers. So basic health workers, vaccinators, malaria surveillance workers, health education assistants, family planning health assistants, all these are replaced by male health worker. So he had given the work of multi-purpose male and female health workers. 1 PHC for 50,000 population, and he also given that there should be 15 to 16 subcenters under 1 PHC, and one subcenter should be present for 3,000 to 3,500 population. In one subcenter there should be one male health worker and one female health worker, and one male health supervisor is in charge for 3 to 4 male health workers, whereas one female health supervisor is an in charge for 4 female health workers. These female health workers are also called as lady health visitors. So all these male and female health supervisors are under the in charge of a doctor in PHC. So this is about the Kartar Singh Committee, where he has put multi-purpose workers with health supervisors also. The next committee is Srivastava Committee, or Group on Medical Education and Support Manpower. According to Srivastava Committee, this Srivastava Committee will create bonds of para-professionals, semi-professionals, health workers. In this Srivastava Committee, we is a village health guide scheme. Here there is reorientation of medical education occurs, so it is called as reorientation of medical education scheme. He has given 3-tier rural health infrastructure, which includes, he has given the wording for Panchayat, followed by Panchayat Samiti, followed by Jilla Parishad at the top. Then he has proposed the referral service complex. For example, if there is a case that should be referred from primary health center to secondary health center, from there to tertiary health center, and he has put forward 2 cadres of health workers, which are multi-purpose health workers and health assistants. Multi-purpose health workers and health assistants are under the in charge of a doctor in PHC. Then the next committee is Krishnan Committee in 1983, or also called as Urban Revamping Committee. There are not much important contributions from this committee. Then we have Bajaj Committee in 1986. This Bajaj Committee has formulated the National Medical and Health Policy. It has formulated National Medical and Health Education Policy. It has also formulated the National Health Manpower Policy and Education Commission and Health Manpower Cells. Then the last committee is, we have High Level Expert Group Committee 2000 level. According to High Level Expert Group Committee 2011, it has given a universal health coverage, and this has also given the 3.5 years MBBS course, which is BSc for Community Health. This is for community health officers. So these are the different committees and their proposals. Thank you guys for watching my lecture. Thank you.